Sometimes when we brush our teeth, our gums bleed. Sometimes this is normal, sometimes it's a concern. Let's talk about this. Hi, I'm Stephen from Clubb Dental, and I'm going to talk about bleeding when you brush your teeth. Now, if you're a bit heavy-handed when you brush your teeth and you get a bit of blood in the sink, that's just the trauma of being a bit rough with your toothbrush. If when you brush reasonably gently, you notice a little bit of bleeding pretty much every time you brush, or when you floss you notice a bit of bleeding, that can be a sign of gum disease. Now, gum disease comes in varying levels. You'll find that the first signs of gum disease can be bleeding when brushing, and maybe a little bit of redness of the gum, generally quite painless. That's usually gingivitis, and that can be reversed a lot of the time using a little bit more effort with your cleaning, a visit to us at the dentist to remove any calcified buildup that you may have that won't come off with your toothbrush no matter how determined you are. If you leave that gingivitis long enough and the tartar is in place long enough, and you've got a few other factors including things like any health concerns or maybe a family predisposition to it, you may well find that you develop periodontitis or periodontal disease. And of the two main problems that we deal with in dentistry, being tooth decay and gum disease, periodontitis or gum disease is the one that is usually symptom-free and can actually lead to the loss of teeth more often than tooth decay. So people get inflammation in their gums, and that inflammation leads to their teeth over time getting loose and being lost. And we're trying to combat that. So it is the generally painless problem that people have that gets left the longest. And ideally, we see you at the earlier signs of that. So we should be ideally seeing you every 6 months anyways. But if you do notice that your gums are bleeding with even just with gentle brushing or flossing, that's not normal, for want of a better term. And you should come in and let us have a look, and we'll talk about it. And we may talk about improving your brushing and flossing efforts and figuring out what you need to do if it's more than just coming in and seeing us and letting us do a cleaning for you. There are some other reasons that your gums may bleed, but again, that would be by far the most common problems that people have. So come and see us if you've got those concerns. And any questions or comments, put them in the comments box down below. Hit like. One other thing is that if you are new to flossing, you may also notice that you bleed a lot when you first start flossing. If you persevere, over the space of a week or so, you'll notice that your gums will toughen up and you will be able to floss without your gums bleeding. And it's really important that you do floss, because in between your teeth is where we find, as dentists, that's where we find most of the gum problems that tend to get away from people. And so battling the inflammation by way of cleaning between your teeth with floss every day, at least once a day, is really important.